Good morning. I am here at the Outpatient Specialty Clinic at the Medical Towers of Tuscan Court with Dr. Sharon Crumpton. And Dr. Crumpton is an audiologist. And if you don't know what that is, it has to do with your hearing. And this is available right here at Magee General Hospital. You can call the office, front desk, they'll direct you to her and you can make an appointment. But I don't imagine you know a lot of what goes on in this little room. And I had to do some twisting to get Sharon to agree to let's film in here. But if you're like me, often if I can see what I'm going to be going to, it gives me a little bit of peace of mind. And so Sharon's going to give us just a little bit of an overview of what they do here and some things that you might can do to save your hearing and to deal with your hearing if you have a hearing loss. So I'm just going to let you head out with it.
Well, if you feel like you're having difficulty hearing, the first thing that you would want to do is see your general practitioner, your family doctor. Get him to look in your ears, make sure that it's not a wax blockage or something medically treatable like that. So you do need a referral from your family doctor or your nurse practitioner to see me, but they would just call the front desk, or you can call the front desk and get an appointment. You'll come here, we'll talk about the problems you've been having, I'll ask you some questions about your hearing, and then we'll test you in the booth here. And this is a sound treated booth, and it kind of helps to control the noise and gives us a more accurate test. You'll listen to some words, repeat the words back. That'll give us a good indicator of how well you're able to hear speech and understand different sounds of speech. And then we'll listen to different frequencies in the speech range, and we'll try to find your thresholds for hearing, and that'll give us a good idea as to the sounds of speech that you are hearing well and what you're missing. And from that I can tell if you have nerve hearing loss, which is the most common type of hearing loss for people over the age of 55. And if you do have nerve hearing loss, the only treatment for that is hearing aids. We'll talk about hearing aids, the different types of hearing aids, what's available, the different technology features today. Or if I do find that there is something medically treatable like a middle ear fluid or ear infection, if I find that there's too much wax in the ear, or if I find that there's something you need to see a specialist about, then I'll make a referral to your nose and throat doctor.
What age do you start? Okay, 55 and older, but do you see children?
I do see children. Actually, 6 months and older, I'm able to test here.
How do they test a 6-month-old?
Okay.
I can't imagine a hearing test for a child.
Well, it's not like we would do for an adult.
Probably that's right. It's not the same way at all.
Well, first we're going to check the eardrums. We're going to check the eardrums for anybody. We want to make sure that it's not something medically treatable like fluid, or as you hear called an ear infection more commonly. And then what we'll do is do some electrophysiological testing. I have some equipment called otoacoustic emissions, and what that does, it puts 2 tones into the ear, and then a normal healthy ear will echo back a 3rd tone that the otoacoustic emission probe picks up. So it doesn't rely on the child to tell us if they can hear.
Oh, okay, that's understandable. Yeah.
But then we also have some visual reinforcement audiometry techniques in our sound booth. And basically what I do is I present some tones through the loudspeakers, and when a tone comes on, a little toy, an animated toy moves. So the child gets conditioned to know when they hear a tone that the toy is going to move. So when they hear a tone, they turn their head. So we have to wait till they're about 6 months so they're able to turn their head, and they have localization abilities to do that. So yeah, we're able to do it mostly through conditioning of the child.
Well, as you can tell, there's a lot that you can learn, and they can start early here. We're going to do our filming in about 3 parts, because sometimes it's easier to watch them. You got just a few minutes to watch, and then you can get the next one. And so we're going to be talking about hearing aids next, and I hope that you'll stay tuned with us.